Good afternoon, everyone. My name is Adeswa Watson, and I bring you greetings from the Suffolk County Department of Health Services, Office of Minority Health, where I'm serving as the acting director. This month, we are recognizing National Minority Health Month, and the theme for this month is Vaccine Ready. So we want to really address some of the questions that communities have in reference to COVID-19 and the vaccine, and we are going to have a conversation today with our health commissioner. So this year's theme, as I mentioned, Vaccine Ready, will focus on the disparate impact that COVID-19 and the pandemic has had on racial ethnic minorities, and we will underscore the need for these vulnerable communities to get vaccinated as more vaccine becomes available. So today we're going to talk about how this pandemic has affected communities nationwide, but more specifically here in Suffolk County, and we will have a conversation with our director, Dr. Gregson Piggott. Dr. Piggott has really only been in the position of health commissioner for about a week when we reported our first case of COVID-19 in Suffolk County. And so he has a wealth of knowledge to share with us. So how are you today, Dr. Piggott?
That's why I'm tired. It's been a long year, but I'm excited and I'm encouraged that in 2021, we have vaccines. We've been doing a lot of vaccinating. We've gotten over the 500,000 mark in terms of Suffolk County residents that have been vaccinated. So we're making tremendous progress. And we know vaccine is really the only way out of this pandemic. So tired, but encouraged.
Yes, yeah. And thank you so much for joining us. We know you have a lot on your plate. So we know that the hardest hit communities in reference to the pandemic have been minority communities, Black African-American communities, the Latinx Hispanic community, Native Indigenous communities. And so it's understandable that because these communities have been historically disenfranchised and underserved, that there would be some hesitancy with communities going out and getting the vaccine. So how can you reassure people that it's okay to trust the medical community and get a vaccine?
Well, these vaccines have been thoroughly researched. And I mean, look at where we are, right? We've had all these people who passed away from COVID, over 500,000 people so far have passed away due to COVID, and it's disproportionately people of color and underserved communities that have borne the brunt of COVID illness. And that's not exempting Suffolk County. Here we have more than twice the fatalities by rate. African Americans are over whites in Suffolk County. That at least double the rate of passing away from COVID is borne by our African American community. So it's very serious, and we have very real numbers and real stories of people who have been impacted by this pandemic. And the research shows that these vaccines are safe and effective at preventing death and preventing serious illness.
So how do you, kind of have the conversation with people who feel there is some kind of secret conspiracy that, this pandemic arose and, the vaccine is not to be trusted? How do you have a conversation and let people know that the vaccine is a great tool to combat the pandemic?
Now, early on in the pandemic, they identified what the cause of the illness was. So they have this SARS-CoV-2 virus. And when you have an opponent or when you have a virus or some kind of pathogen, and you're trying to design a vaccine for it, you had to identify what are the strengths and what are the weaknesses of this virus. I use an analogy like when you have a sports team, you have your opponent coming up, and okay, what are their strengths, what are their weaknesses? There's a point guard there, and the basketball team, he can't dribble to his left. Let's guard him that way. So you have to do some kind of an analysis of the situation you're presented in and figure out what is the best path forward. How can we exploit the weakness of our opponent so that we can design some kind of a strategy to beat them? And what they found out with this particular virus, it has spikes on it. That's why it's called the coronavirus, corona meaning crown, and the crown has a bunch of little points. And so they said, these spikes are a potential weakness of this virus. So they designed vaccines using some kind of piece of that material of the spike protein. And the idea is to train your immune system to recognize these spikes as something foreign and something that needs to be combated, something that needs to be fought against, and giving your body the tools to beat that virus as it tries to invade your cells and say, you shall not enter here. So very important that technology, once they identified the weakness of that virus and that hypothesis, that theory that those spikes were the way to neutralize the virus, have proven to be effective. So that theory from day one, once they identify their weakness, All the vaccines that they tried, designed to exploit that weakness have worked.
Wow. Thank you for sharing that. I think it was a really clear and easy way to understand how vaccines work in the body. And so, with that being said, do you hear as commissioner, when you're out in the community, when you're at pods, do you hear any misconceptions, that may arise around the vaccine? Any misconceptions about, that you feel like you need to clear up in reference to the vaccine?
Yeah, I mean, the biggest one that people are concerned with is down the road, I took this vaccine, and am I going to get some kind of crazy side effect, or is my hair going to fall out, or, I'm going to have some kind of health issues related to the vaccine? And the answer to that is no. What we've seen so far, these vaccines are safe and effective. The material in the vaccine, whether it's a messenger RNA-based vaccine or a viral vector vaccine, these are not things that stay in your body long-term. Your body learns what it needs to learn from the vaccine, and then these materials are quickly disposed of. So it's not something that lingers for years and years in your system, waiting to create havoc or some other untoward side effects. The vaccine does what it's supposed to do, trains your immune system to recognize those spikes on the virus and teaches you how to combat it.
Yeah, and for folks who feel like, well, it was made so quickly, how do we know how effective this is? Can you speak to clinical trials and how representative it was of folks in the community? How many people were in clinical trials?
Right, so you've had clinical trials for the major vaccines that have been approved, the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine in the US, and overseas, the Oxford AstraZeneca vaccine. And these clinical trials were conducted in various countries, conducted across various races and ethnicities, and has shown no side effects or serious complications due to the vaccine itself, and are deemed safe and effective. They prevent infection, and they prevent hospitalization and death.
Oh, thank you for sharing. So I think a great question that I'm pretty sure a lot of people have for you is, have you been vaccinated, Dr. Piggott?
Yeah, I was in the 1A category, so that's essential healthcare workers. And I was eligible back in late December, so I took advantage of that. I went to Stony Brook, and I got vaccine number 1 of Moderna in late December, and then I got the follow-up number 2 vaccine in late January. And I'd say after the first vaccine, I got it in my left arm because I'm right-handed. My left shoulder was sore, my deltoid muscle in particular. It felt like I'd gone to the gym and I was doing a bunch of raises and really focused on that one particular deltoid muscle, or maybe like somebody punched me in the arm. So that was the first thing. That went away after a day or two. Shot number 2, I remember I got it on a Thursday afternoon, and Friday, I went to work, went to the office, and I noticed how cold I felt. And I'm like, well, it's 20 degrees outside. That's why I'm cold. But yet I went into an indoor environment where it's 72 degrees, and I'm like, I'm still cold. So I'm like, what is going on here? And then that just got worse. And then I was getting a little lightheaded. And so at some point, I'm like, I need to drive myself home and just lie on the couch somewhere. So I had that reaction when you get the fever, the chills, the muscle aches, the fatigue. And that doesn't mean you're getting sick from the vaccine. It's just your body reacting. And actually, it's your immune system in particular reacting and doing what it's supposed to do to recognize that material, that spike protein material. So it's actually a normal vaccine side effect, and it's really important actually for your immune system. Not everybody gets that, but I was one of the unlucky ones that got that severe reaction. So Friday, I was kind of laid up in the house, and Saturday, a little bit better, and by Sunday, I was back to normal.
So it's really not something that people should be too worried about. Like, the side effects is not something that people should fear. It's a normal process when you get a vaccine.
It's a normal process. And then if you take regular anti-inflammatories, your Advils, your Tylenols, that'll help you through it. Make sure you drink plenty of water. But if you get that particular side effect profile, it's going to be gone within 2 days. Okay.
So moving forward, now that we know that there is more vaccine coming into the state and the county, what are your hopes for the future?
My biggest hope is that everybody who's eligible gets that shot. We need to get to that place what they call herd immunity. And what that is that if somebody who is not vaccinated gets exposed to COVID and is sick and is coughing and spreading virus, that if you're vaccinated, now that virus stops when it gets to you. It's like you have the defenses already in place for that. Your body's going to recognize, hey, this thing with spikes on it is trying to invade me and cause harm to my lungs and other essential organs in my body. So I'm going to go and fight it because I have antibodies because I got the vaccine. So you need a whole bunch of people around that person who is unvaccinated and who has COVID. And then that virus has to stop in its tracks because it cannot spread because there are enough vaccinated people so that it cannot do damage and spread beyond that particular person who got the infection in the first place. So we need to reach that place. That is considered to be about 75% of the population, and we are currently at around 35%.
Okay, so we're making progress, but we need to do more.
We need to do more.
Yeah. So thank you so much, Dr. Piggott, for joining us today for this conversation for National Minority Health Month. We don't want to take up too much of your time because we know the work that you're doing is important. And so for all the folks out here who have joined us today that really want more information about COVID-19 and the vaccine, you can visit the county's health department's website, which is www.suffolkcountynY.gov/vaccine. You can find out where we have pods to sign up for appointments for vaccine. And you can also look at the frequently asked questions section to learn a little bit more if you have concerns. And also, we want to encourage you to utilize the hashtag for National Minority Health Month. The Health and Human Services Office of Minority Health has created the hashtag Vaccine Ready hashtag for folks to share on social media. If you want to share your stories, if you want to share conversations that you're having, please use that hashtag Vaccine Ready. All right. Thank you again and be well.
Thank you.